My name is Dr. Kim Orchard, and I'd like to present this poster on the use of an yttrium-90 labeled anti-CD66 monoclonal antibody as the sole conditioning prior to autologous stem cell transplantation for AL-Amyloidosis. This was the TRALA study. These are my disclosures, none of which are relevant to the presentation. Despite advances in the treatment of amyloidosis, autologous transplantation remains an important option, and patients who achieve complete responses have improved long-term survival, improved organ function. However, there have been no major changes to the conditioning used for the last 30 years, with high-dose melphalan still the standard of care. But this is associated with significant morbidity and mortality in this vulnerable patient group, and perhaps only 20% are eligible for transplantation. So clearly new approaches are required. The TRALA study involved the use of this investigational medicinal product, yttrium-90 labeled anti-CD66, which we have used successfully in other transplant settings. It was a phase 1 3+3 trial with three radiation levels of 30, 40, and 45 megabecquerels per kilogram lean body weight of the recipient. There are additional safety factors of radiation dose limits to the bone marrow and liver. Primary aim was to determine safety and toxicity of the agent in the context of patients with AL-Amyloidosis using standard criteria. Secondary aims were to determine clonal responses by measuring free light chains and clonal malignant plasma cell population in the bone marrow pre and post-transplant, cardiac recovery with NT-proBNP levels, impact of yttrium-90 on time to progression, time to next treatment, and overall survival. To determine the utility of a dosimetry model we previously developed in transplant patients undergoing transplant for other malignant conditions, and also engraftment using EBMT criteria and hammer formation. This is the dosimetry and therapy schedule we used. So patients underwent indium-111 labeled anti-CD66 infusion with gamma imaging for 3 days. If they passed the dosimetry successfully, they went on to receive the yttrium-90 labeled antibody 2 weeks prior to an infusion of autologous stem cells. All of this we were able to deliver on an outpatient basis. These are the patient characteristics, and as you can see, the majority of patients had multiple lines of previous treatment, including 3 that had had prior autologous transplant with standard high-dose melphalan. All patients had variable degrees of organ damage at time of transplant. These are the results on the left-hand side of the patients with their associated infused yttrium-90 activity level in megabecquerels. And the middle of the table shows the estimated organ radiation doses in gray. And clearly the bone marrow received the highest dose of radiation, up to 45 gray in some patients. Spleen was the next highest uptake organ, which was acceptable. And all other organs had very low levels of radiation. Disease responses are shown on the left. On the right-hand side of the table, and 2 patients achieved CR within 100 days of transplantation. 4 patients continued, however, beyond day 100 to show falling levels of malignant free light chain, with 1 further patient achieving a normalization of free light chains beyond day 100. 6 patients did not require any additional treatment. This histogram more graphically shows a relationship with the radiation doses of the bone marrow and spleen receiving the highest dose levels of radiation. Toxicities, there were no SAEs and SUSARs associated with the agent. Adverse events were predominantly mild. There are only 3 moderate and 3 severe recorded. All patients engrafted. So in conclusion, the yttrium-labeled anti-CD66 effectively targeted the bone marrow, resulting in marrow suppression. Its toxicity, however, was minimal. All patients maintained oral nutrition with no mucositis and no diarrhea. There were only 2 episodes of neutropenic fever, neither were serious, and all patients engrafted. Disease responses were encouraging, with 3 CRs eventually being recorded and 4 PRs. This lack of toxicity and evidence of disease responses in heavily pretreated patients with AL-Amyloidosis warrants further investigation, and potentially patients who are currently not eligible for high-dose melphalan could be included. And also the agent has potential in a wider range of hematological malignancies. These are my acknowledgements, and the study was funded by Blood Cancer UK. Thank you for listening.